Hi guys, Mia Savitas here. I have my angel Amanda beside me, my chiropractor. She came into my life about 2 years ago roughly because I was experiencing severe low back pain, so bad. I was starting a 21-day challenge and I was literally walking around like a plane was going to take off, and I thought for sure I had to have surgery. The discs were all messed up. I was a goner. And I was referred to Amanda, and she has healed me miraculously, that it wasn't as severe as I thought it was. Most of it has come from years of training, doing lunges and squats, sometimes right, sometimes not so proper, and not stretching enough, because of course I was invincible back then and I didn't need to stretch and I didn't have time. So this low back pain that I really felt was going to need surgery of some sort really is coming from my hips. Who knew? Or people that have knee issues, it's coming from their hips as well. So the stretching becomes extremely important in your life, and take it from me, if you're younger, please start doing that immediately. So Amanda is here to demonstrate some of what she's been doing to help me, and I've been pretty much good ever since. What I do like to come is once a month for maintenance, the same way you would maintain your car or anything else that you want to run like a well-oiled machine. And I do want my body to run that way, and I do a lot of working out, so it's important that the rest of it is in sync. And so Amanda, credential-wise, and I have to say, you know, my daughter comes here, my husband comes here, and John, as you know, is quite the baby. He has been all over the world seeing all kinds of different therapists through the years, and he feels the same way about Amanda as I do, so that should say a lot. Amanda.
Thank you, Mia.
You're welcome.
Thank you.
You're welcome.
Hi everyone. I'm so happy to be part of the team. I'm Dr. Amanda Shioni, and I am a chiropractor. So what we're going to do today is I'm going to tell you a little bit about how I practice and how it may be different to what any of you have experienced in the past with other chiropractors. And I'm going to kind of take you through how I've helped Mia, and also give you guys some tidbits of information as well to help you along the way and to help you perform better and reach your goals in the gym, because that's what ultimately I'm here to help you do. So I'll tell you a little bit about how I practice. I use a combination of modalities for treatment. Acupuncture, specifically medical acupuncture, on probably 99% of my patients. So it's a huge part of my practice and one of my specialties. We use it on Mia, often on her little girl as well.
Yeah.
So it's been really helpful.
Mm-hmm.
And then I also use something called active release therapy, so it's muscle release. And then, as all of you know, your typical adjustments that chiropractors do, I also do that. We're going to talk about low back pain because it is very prevalent. So I'm looking for the cause of your low back pain. Why does this keep happening? So we don't want to do this patchwork, you know, adjust the back. We want to find the cause of your low back pain, okay? So I'm going to lay Mia down, and we're going to move her hips around.
Or the ones that won't move.
Yes. And see how they're moving today. So I haven't seen her in a few weeks, so we'll see how things are moving. So I'm just going to check her rotation so you guys can sort of see how it moves really well in this direction. This is called external rotation, and this way doesn't want to move so much. So this is what we've been working on, okay? And then we're going to go on this side. So beautiful hips that way, and this one moves a little bit more on this side, but still some work to do.
Which makes sense, because mostly my pain is on the right side, although
yes,
the back is not great.
So what we're going to talk about briefly is, it's called the joint by joint approach, okay? So what happens in the body is either a joint is made for mobility or stability, and it alternates in the body. So your ankles are built to be nice and mobile, your knees stable, your hips mobile, your low back stable, your upper back mobile, and it so on and so forth. So what happens oftentimes, what we see, people that work at a desk, that sit all day, they have really tight hips. So what happens is, when you lose mobility in your hips, either above or below has to compensate. So either you're gonna get the low back or the knees moving too much. Now the problem is that those are more built for stability, okay? So the fix is not to treat the low back in patients with low back pain, because the cause is often coming from the hips. So what I do for Mia is, we're gonna loosen up her hips using active release therapy. This is a muscle release technique. And then also acupuncture. What acupuncture does is it gets blood flow to the area, and within the blood is oxygen. So it's the most direct way that we can get oxygen to the muscles. So after we loosen Mia's hips up, she could go work out, and so she can actually utilize her hip muscles when she's landing from a squat, when she's running on the treadmill, and she can absorb the force through her hips because now they're loosened up and you can get maximal output from these muscles now, okay? So this definitely applies to most people, especially people that have desk jobs. Their hips get really tight, their hip flexors, they're all in this position all the time. People at home cooking, bent over a sink, driving your kids around to all of their competitive sports. That happens a lot these days. I'm gonna treat Mia, and we're probably gonna shut off the camera because there may be some wincing, there may not be.
It's okay, they can watch me, I'm tough,
Okay.
Whatever you need to do.
Okay. That's a little bit about how I practice. I'm here on Tuesdays, and stay tuned for more tidbits of information.